So what I'd like to do, because this is a pretty small group, I'd love to actually start off um, with any questions. See what questions you have. And then what I can do is I can say whether or not those questions are going to be answered as we go through this presentation, and perhaps tailor the presentation a little bit to some of those questions. So I just want to make sure if you have burning questions that you're not kind of like sitting there with these questions burning. I can incorporate them now and start to answer some of those questions as we go through the presentation. And it's okay if you don't have any questions right now. Questions can always come up as we go through the presentation, but I want to give you the opportunity right now to ask any questions that might be really sitting in the back of your head. So with that, I'll give you guys a minute or so to kind of state any questions you might have.
This is Polina. Can I ask a question?
Of course.
I wanted to know, I took the first and second vaccine with Pfizer. Is it really a must to take the third one? Is it a must? You have to take it?
That's a great question. That is a very good question. And so, Kanina, I'm going to collect these questions, and I'm going to talk a little bit more about them as we go through the presentation.
Okay.
I had a question, Dr. Scales. Can you hear me? Okay.
I can, yes.
Okay. As an immunocompromised person who did not get any antibodies from the first two shots, but got a few antibodies from the booster. Okay. So the question is there any treatment in the near future that that immunocompromised people can get, like maybe the monoclonal antibodies or something, so that we could get out of hiding? That was one question. And another quick question is, are there any blood pressure drugs which make us more likely, which lower our immune system? That's the question.
I'm just writing these down. These are good questions. Excellent. And I see in the chat, Ms. Jacta has also asked a question. Is it possible, perhaps referring to Kamina, is it possible for her to get a full-strength Moderna vaccine after the 2 Pfizer shots? And Ms. Jacta, I think I remember our discussion from a week ago that you do have a preference for the Moderna vaccine because it has a higher dose of mRNA, even though the equivalency in terms of immunological outcome between the Pfizer vaccine and the Moderna vaccines are close to equivalent. That's something we'll definitely go into. We'll have a brief discussion about these booster shots. And I will definitely, I will be able to answer these questions. And sir, who asked the question about the immunocompromised, being immunocompromised, what's your name, sir?
Paul.
Hi, Paul. Great. Okay, these are great questions. I will make sure that I address these as we go through the presentation. Any other questions before I begin? I see someone at the Stanley Isaac Center is raising their hand. Please go ahead.
Okay, I have the Pfizer. Is it mandatory? I know that you answered the question to have the third, the booster.
Excellent question. Okay, so because this is a question that's come up twice, I think I'll address it now. So I'll repeat the question. So the question is essentially for those people who are asking, and this is a question now because the recommendations have come through for both Pfizer and Moderna vaccines, that if you've had 2 shots, do you need to get the booster? Is it required? And what I would say is this is still very much evolving, all right? So, because there's two sides to this. One is the medical side, and I'll discuss this first. And then the other side is relating to policy, things like vaccine passports and such. And so from a medical perspective, it is not required for someone to get a booster vaccine. It is recommended. And so, I always recommend having a discussion with your doctor about risks and benefits. Generally, for people over the age of 65, it looks like it's a good idea to get the booster because over time, our immunity to COVID declines, whether we got COVID and recovered or whether or not we got the vaccine, either Moderna or Pfizer. And with the immunity that declines over time, at a certain point, the benefits of a booster are going to become clearer and clearer. When exactly to do it, I think is up to you. Whether or not to do it is also, again, right now, it is a recommendation, so it's also up to you. And I think it's best to have that discussion with your doctor, with the healthcare professional that you trust to decide if it's right for you. Now, that said, that's the medical side of things.
वो
Now,
कह रहा है कि
there's-
अपने डॉक्टर से डिस्कस करो और उसको पूछ लो वैसे रिकमेंडेड इट इज नॉट required it is recommended that you take over 65-year-old people. That's what Nalini told too. Should take the booster because our immunity system become weak, and because of you take this booster. Hello,
I'm listening.
मैं बोली उससे डिस्टर्ब हुआ क्या वहाँ?
I think we might have lost our participant. I was able to kind of hear her question briefly.
So he's saying it is recommended, but you still talk to your doctor. And there are Moderna and Pfizer, दो company का.
So if I hear you correctly, because it was difficult to hear, you were asking whether or not it was mandatory to get the vaccine booster. Is that correct? You sound very far away. I can barely hear what you're saying. Okay, well, we might come back to that questioner once we can hear her a little bit better. I do want to address the idea of whether or not the boosters are required, because right now that definition of what is required is changing. So, for example, if you want to go to a restaurant in New York, if you want to go to a Broadway show, or if you want to travel certain places, like say you have family in Canada or Europe, they are asking that you be fully vaccinated. As of right now, fully vaccinated is defined as being 2 weeks after 2 vaccine doses with Moderna or Pfizer, or being at least, I forget the number of weeks, but it's a certain number of weeks after the Johnson & Johnson vaccine. These definitions, it is possible that these definitions of what is fully vaccinated might change. And so while it's not required, could we perhaps mute some of the people that are...
Yeah, is it possible you can mute some of the participants? We're getting a lot of feedback.
Yep. Or if you make me co-host, I'm happy to help with muting. I was muted. Perfect. Okay, everyone's muted. And don't forget, *6 helps you unmute if you need to. So it is possible that the definition of what is fully vaccinated might change over time. But for right now, it is not a requirement for you to get the booster vaccine. It is just medically recommended. So you're going to have to watch very closely to see if that changes. I've also received another question from someone who has asked me whether or not there are human embryonic cells used in the production of the vaccine. So I want to be very clear about this. So for the Moderna and Pfizer vaccines, absolutely not. Human embryonic cells have absolutely nothing to do with the Moderna and the Pfizer vaccines. The Johnson & Johnson vaccine, there were human embryonic cells that were used in the research, but they are not used in the production of the vaccine. So to be very clear, there's absolutely no human embryonic cells in the vaccine themselves or used in the production of the Johnson & Johnson vaccine. And the Johnson & Johnson vaccine was the only vaccine that is available in the United States that used human embryonic cells in the research and development. And if that is of particular concern to you, religiously or not, I highly recommend getting the Moderna or the Pfizer vaccines, or consulting with one of your religious officials. Many religious officials say if the only vaccine that's available to you is the Johnson & Johnson vaccine, it is still morally acceptable to get it. But thankfully, in most places in the United States, you do have the alternative to receive the Moderna or Pfizer vaccines, which have no relationship and nothing to do with human embryonic stem cells. So Paul, I do want to get to your question. And I'd like to get through the presentation a little bit, and that will allow me to put the issue that immunocompromised people are facing in context. So I haven't forgotten your question. I'm just going to address it as we go through. Any last questions before I start the presentation?
One more question.
Please.
So, if I had taken Moderna as the initial two vaccines, should I take a follow-up also Moderna, or it could be Moderna and Pfizer?
Excellent question. And this was something that was alluded to by Ms. Jakta. In general, so right now, the current research in the United States says that, and the recommendations, which are based on that research, says that if you received Moderna vaccines, you should get a Moderna booster. If you received a Pfizer vaccine, you should get a Pfizer booster. There's current discussions underway right now about if you got a Johnson & Johnson vaccine, should you get a booster? And if so, what kind? But I think this research is very much evolving. And it will likely change. There's a lot of research studies that are looking at what we call mixing and matching the vaccines. And so it is possible that you might hear different things as we go forward. But right now, the recommendation is if you are someone who received the Moderna vaccine, you should get the Moderna booster. If you receive the Pfizer vaccine, you should get the Pfizer booster. And just to be very clear, there's no data that suggests that there's a drastic difference between getting one or the other. So right now, it's still very much of an open scientific question. One of the things we do know is that getting a booster shot has a very good impact on increasing your immunity. And so it does not seem to matter right now. There are some people who feel very strongly about wanting to mix and match, but there's not a lot of data right now that suggests that that's actually better for you than continuing along with the series of vaccines that you started with. So just to be very clear, that the current public health recommendations are if you got the Moderna vaccine, to stick with the Moderna vaccine for the booster shot. And if you got the Pfizer vaccine, to stick with the Pfizer vaccine for the booster shot. That said, I want to also be very clear that there's a lot of, while that is the recommendation, there are a lot of people that are taking it upon themselves and going and getting whatever booster shot they want. And that's, relatively speaking, easy to do, because if you just go to a pharmacy or different places, the vaccines are available. And so I want to be clear that you can do that if you want, but I also want to be clear that that's not something that is well studied enough so that we know the safety and the efficacy of that. So there's some potential risk in that we don't yet fully understand. Good questions. Thank you all for the questions. I think that's very helpful. I'll dive into the presentation, but please do, if there's questions that come up as I'm going through the presentation, please feel free to comment. While I'm doing the presentation, it's hard for me to see people on screen, so I wouldn't raise your hand. I would just excuse yourself, put yourself off mute, excuse yourself, and go ahead and ask your question.
Can I ask a question?
Of course.
I know it's very hard to predict the future, but is there any info on when is this going to stop, this whole COVID thing?
Right, that's the question of the day. Excellent question. I've read some articles about what some people are calling, like, when are we going to reach the end of COVID, or what does a COVID endgame look like? And the short version is, I think COVID is going to be with us forever. Now, that said, I think it's going to be, it's not going to be in the same way. So, you know, there's certain things, there's diseases that we live with. We live with cold viruses, we live with influenza. And I think, you know, after a short period of time, we'll probably be thinking about COVID like we think about something like flu or other cold viruses, which is, you know, influenza is a threat every single year. Tens of thousands, sometimes hundreds of thousands of people in the United States die of the flu every year. And so it's something that every year there's public health campaigns about getting vaccinated, taking precautions like washing your hands. And I think we're going to be moving in that direction when it comes to COVID. When is that going to happen? As you said, I can't predict the future, but I think this winter is going to tell us a lot. If we have a lot of people who are vaccinated, if there's not a whole lot of COVID this winter, I think we might start to see a lot less news coverage, a lot less kind of fear, and we can start moving towards treating COVID like it is a public health concern, but I think we'll ultimately get to a point where it's not such a public health concern that we need to rearrange our entire lives around it. And I know everyone's looking for that day to come as soon as possible. All right. Good questions. Please keep them coming. So with that, I'll just go through kind of the overview of the vaccine. But obviously this is, you know, there's a lot of information about the vaccine out there. And so a lot of this will be review for a lot of you. And that's why I'm happy to interrupt to go through questions. All right. So why should you get vaccinated? It sounds like a lot of you are already vaccinated, which is fantastic. And we often say there's 3 reasons: to protect yourself, to protect your family and your community, and to help end the pandemic. You should get vaccinated to protect yourself because the symptoms of COVID are pretty stinky. I've seen a lot of patients with COVID, and it is, you know, sometimes if you're lucky, there's not many symptoms, but sometimes it can be pretty debilitating. The symptoms can be a lot like having a cold, with coughing, fevers, runny noses, sometimes shortness of breath and fatigue. But there's also a lot of other symptoms that kind of come that are not so typical for colds, and that's losing your sense of taste or smell, or having diarrhea. Those don't usually happen with most cold viruses. As you can see, this presentation is a little bit old. We've already reached, COVID-19 has resulted in over 720,000 deaths nationwide. And obviously death is something we're all concerned about, but COVID, it's not just about the number of people that it's killed, which is obviously very concerning. COVID also can cause long-term health problems because it can cause kidney problems, it can cause clots. So it can cause clots in different places like your lungs, or sometimes it can cause clots in your brain, which would be strokes. So just the number of health complications that can come from COVID, it's really important to recognize that this isn't just a question of, do you live or die? It's a question of whether or not COVID causes a lot of long-term problems for you. And I mention that because there's a lot of people who say, oh, well, the vaccine's not necessary because your chances of dying from COVID are very small. And well, statistically, that is true. But your chances of having some sort of long-term side effects are much higher than your chances of dying. It's we think somewhere about 15 to 20% of people might have long-term side effects from getting COVID. And that's a lot of people. That's millions of people at this point. So this is why if you have younger people in your family who think, oh, I'm young, I don't need the vaccine. If I get COVID, it's not going to be a big deal. These are things that I tell young people is that, even young people who get COVID, it's no joke. Sure, your chances of passing away from COVID are low, but it's still not a fun thing to get. So other reasons why it's worth getting vaccinated is that even people that have had COVID, there's more and more studies that show getting a vaccine even after you've had COVID boosts your immunity even more. And so, even if you feel you're protected because you had COVID, it can be helpful to get a vaccine because that just makes it even reduces your chances even more of getting COVID again. So when it comes to knowing some pertinent facts about the COVID-19 vaccines, it's important to know what the vaccines can do and what they can't, okay? So getting a vaccine can help prevent you from getting sick with COVID-19. Now the vaccines, the Moderna and Pfizer vaccines are 95% effective. That means even if you've been vaccinated, there's still 5% of people who could get what's called a breakthrough infection. And so the vaccines do not prevent infection 100% of the time. So you'll sometimes hear people complaining that the vaccines don't work because some people are still getting infected. I would say something that works 95% of the time is a pretty fantastic thing. Sure, I'd love it if it's higher, but 95% effectiveness is hard to come by in medicine. And so I'll take it. But that does mean we still have to be careful. Even if you've gotten the vaccine, it is possible. You've got, a small chance of getting COVID. That's worth keeping in mind. People who have already gotten sick with COVID-19 from getting vaccinated, there's more and more data coming out to suggest that this is true. And it's also very important to be extremely clear that the COVID-19 vaccines cannot give you COVID-19. They do sometimes cause side effects, like a sore arm or sometimes fevers, and we'll talk a little bit about that. But that does not mean that you got COVID-19. COVID-19 is a very different thing than the side effects of the vaccines. It is impossible to get COVID from the vaccines themselves. And finally, COVID-19 vaccines will not cause you to test positive on COVID-19 viral tests. Now that's important to know. There was someone who asked a question. So it's important to recognize that we do have tests that can check various things. And so after you've gotten the vaccine, you can get tests to see if you have COVID antibodies. And so you could have a positive test for COVID antibodies, but that is very different than a positive COVID test to see whether or not you've got immunity against COVID. And a COVID test is very different. It's looking for COVID itself. COVID-19 vaccines cannot and will not cause you to have a positive test for COVID itself. It's important to know. Now, do the vaccines work? Yes. I've said very clearly that there's about 95% effectiveness for the Moderna and the Pfizer vaccines. And all COVID-19 vaccines that are available in the United States are highly effective at preventing COVID-19. 1 in 20 people who got the COVID-19 vaccines from Moderna or Pfizer are also still susceptible to getting COVID itself. Again, 95% effectiveness means 5% of people don't generate as much of an immune response as they need to protect themselves, and 5 is 1 out of 20. So it is important to recognize that even though the vaccines work, that there's still a risk of getting COVID. Now, some people had a lot of questions about how they made the vaccines quick. So just to be clear, they did not take any shortcuts in terms of safety or efficacy to study the vaccines. So the COVID-19 vaccine is based on decades of research for similar vaccines. To give an example of that, so I happened to work from 1998 until 2001. I worked as a student part-time in Drew Weissman and Kate Carrico's lab at the University of Pennsylvania, where they developed some of the foundational technology for the mRNA vaccines. That was over 20 years ago. So it tells you that the roots of these vaccines, the research that has been done on these vaccines started over 20 years ago. And it's taken decades to get to the point that we could apply a lot of this information to COVID. And generate a vaccine as quickly as we did. And the way we did that was by overlapping timelines in the regulatory process to speed that process up. But all of the same safety standards and expert reviews were used as they are in all vaccines. As you can imagine, this was a global emergency. So everyone on these expert panels cleared their schedules and made this the top priority. So it helped go through much more quickly than a typical drug or vaccine, which often takes a long time because there's, the scientists and experts are very busy. But this very clearly went to the top of everyone's agenda. There's a lot of questions about this new variant called the Delta variant. Now, as viruses spread, they change, they evolve, they morph. And there are new variants that have come out. And so far, the one that has been most recent, that is very predominant right now in North America, is the Delta variant, which is more transmissible than the first version of COVID that came out when the pandemic first started in the spring of 2020. Now, that said, even though it's more transmissible, vaccination has been shown to be very effective against the new variants. So far, there's not a variant that has come out that the vaccines do not work against. Or to say that a different way, the vaccines so far are working against all of the variants quite well. Now, the efficacy for the vaccines is slightly decreased for the variants, but still very highly effective. And so that they are our best tool to protect ourselves against even the variants. Are the vaccines safe? Yes. So the vaccines were studied in tens of thousands of people, a very diverse group of people that included everything from Native Americans to people living in international contexts, a number of people from the Black community, Brazilians. If you're looking for specific groups, that were studied, that were in the clinical trials for the vaccines, there's a very good chance that they're there.
Thank you for calling Empire. If you're a Medicare member and would like to chat with a live agent via text message,
perhaps we could mute some of the inadvertent.
Right. I think you're all set, David.
Thank you very much. The vaccines are safe. They've been studied in tens of thousands of people. And about, if you think about it, since the vaccines have been distributed, in the United States, about 200 million people have gotten at least one dose of the vaccine. And that's just the US. Over 1 billion people in the world have gotten the vaccine. So, scientists are constantly studying kind of, are there any kind of side effects that are happening? And we're constantly learning about the vaccine. And so far, the vaccines seem to be extremely safe. Even some of the side effects that some people are talking about happen with about the same frequency. Like you've got about the same chance of getting some of those side effects as you do of getting struck by lightning at some point in your life. So thankfully, it suggests that the vaccines are very safe, and the chances of having a bad side effect from the vaccines are very low. In the United States, over 170 million people have been fully vaccinated, and a very, very small number of people who have been fully vaccinated are having breakthrough hospitalizations, or in extremely rare circumstances, dying. And so the vaccines are doing a much, much better job at protecting people than we could have expected or hoped. Now, putting this in context, so let's compare people who've been vaccinated and people who are unvaccinated. And in New York City, in the 8 months from January until August, if we look at all of the cases, all of the hospitalizations and all of the deaths, so if you look, the kind of the yellow part is the percentage of people who were vaccinated, and the blue is the percentage of people who were unvaccinated. And as you can see, unvaccinated people made up over 95% of the cases, the hospitalizations, and the deaths over the 8 months from January 17th to August 17th in New York City specifically. So I think this is very strong evidence that if you're vaccinated, you are very well protected against both infection and hospitalization or death. To put this another way, unvaccinated people have a 5 times greater risk, 5 times more COVID-19 infections than fully vaccinated people, and 29 times more hospitalizations than fully vaccinated people. So who can get the vaccine? So right now, eligibility criteria are all New Yorkers aged 12 and above are eligible for COVID-19, regardless of your immigration status. COVID-19 vaccines are free. You do not need a social security number or a government ID to get the vaccine. If you want to make a vaccine appointment, there are a lot of resources to do this. You can call the various numbers that are listed on this screen. It is also possible to call numbers in Spanish. The 833 Somos New York number is one that works for Spanish speakers. And at various different kind of mass vaccination sites around the city, there's still the availability of the vaccine. And now even in a lot of private, because there's still that 20 chance you could get COVID, and because immunity tends to decline over time, public health recommendations still are, public health recommendations are still that you should cover your nose and your mouth with a mask. Still try to stay 6 feet distant from people you don't live with, trying to avoid. It's going to be someplace where I don't know the vaccination status of the people around me, like if I'm going to be on a bus, for example, then I'm absolutely wearing a high quality mask. So I don't use the cloth masks anymore. I'm using either kind of like one of those hospital masks or something called an N95. There's increasing data to suggest that the higher quality mask that you have, kind of that helps reduce your risk of COVID. So that's something to keep in mind if you're still going out. Enrolling in VSafe is a good idea. And of course, if you have any specific questions about your health and vaccination, I always highly recommend kind of if you want to get personalized advice based on your specific situation, your doctor, your clinic is going to know you best. And so they're the best people to get medical advice from. Now, we know that there's questions, and this is just information that is kind of, that is very important context. But there's a lot of other information that you guys have heard from family, relatives, perhaps seen on social media. So we want to have those discussions. just so we can all be on the same page about the type of questions that you have. And as there is uncertainty, we can't necessarily always be certain about every single answer to the question, because science changes as more evidence comes out. So these are some of the questions that some people have asked in the past, but I don't want to put words in your mouth. I want to open it up for questions again and see if anybody has any other things that they would like to talk about. And of course, if anyone would like any more information, please, absolutely, these are excellent websites to go to. With that, I'll give you a second to think, and I'll answer Paul's question from the beginning, which was about those who are immunocompromised. So people who are immunocompromised, those are people who have weaker immune systems than the rest of us, and that could be for any number of reasons, due to chronic medical conditions, like cancer or things like that, or from medications that they might be taking that weaken the immune system. So it is highly recommended for people who are immunocompromised to get booster shots. And the part of the reason we talk about how it's important to vaccinate, when we talked about how there's 3 reasons to vaccinate, it's to vaccinate yourself and protect yourself, to protect your family and protect your community. It's because even if we vaccinate as many people as possible, different people have different immune systems. And so we need to rely on a concept called community immunity. Community immunity, sometimes people call it herd immunity. I like to call it community immunity because we're a community, we're not a herd, right? We're not cattle. So if we're a community, we should be doing things to protect other people in our community, because there's some people who can't get a vaccine. So for example, anyone under the age of 12 can't get a vaccine. And there's people for whom the vaccines don't work very well. And that's a lot of people who are immunocompromised. And to protect those people in our community, the more people that get vaccinated, the more we can prevent transmission and the more we can protect everybody. And so I think what is going to be the most important thing to protect the people that are immunocompromised in our community is to get as many people vaccinated as possible. Now, that said, vaccination rates in different places are not as high as they need to be to get that protection, that community immunity that we're looking for. So Paul, your question about is there any treatments that will be available in the near future that might help you get out of hiding? The thing that I would say is, unfortunately, I think for immunocompromised people, I think it's going to be important to take a lot of precautions for the foreseeable future. And those are doing exactly the things that I mentioned earlier, wearing the highest quality mask that you can, kind of at least a surgical mask, if not an N95. And these are surgical masks, these nice little masks that surgeons wear, or an N95. I think that's going to be extremely important. Washing your hands, socially distancing if you're able to, because I think as an immunocompromised person, until we reach the levels of community immunity that we need to, there's always going to be a bit of a chance for you to get it. And Paul, your other question about, are there any blood pressure medications that lower your immune system? The short answer to that is I cannot think of one. Now, there are blood pressure medications that have side effects, right? There's blood pressure medications that can cause kidney problems, blood pressure medications that can cause swelling, various different things. And so but those are different things. Blood pressure medications generally do not affect the immune system, thankfully. So I wouldn't be too worried about taking blood pressure medications and whether or not you can get the vaccine. Usually the vaccines were well studied in people who had high blood pressure, and the benefits of the vaccine far outweigh the risks. If you have specific questions about a blood pressure medication that you're taking, I do recommend talking to your physician, because that's always the person who's going to know you best. because they'll be able to say whether or not it might not be the specific blood pressure medication that you need to worry about, but perhaps you have an underlying condition that they want to talk to you about before you get vaccinated. So there's some questions coming in through the chat. So some people are asking about the next variant, the Mu variant. So after Delta, so the WHO is labeling the different variants of COVID with Greek letters, and so far they're on Mu. So the Mu variant it's still extremely new, and there's not a lot of studies, but the studies that I've seen have shown so far that our current vaccines are still highly effective against the Mu variant. Now, again, I wouldn't say that they're 100% effective. It's important to recognize that as new variants are coming out, we are seeing a decrease in effectiveness of the vaccines, but still, the conclusion that scientists are drawing so far from the data that we have is that the vaccines are still highly effective at preventing both infection and hospitalization and death from all the variants we've seen, and that includes Delta and the Mu variant. There's another question that came through asking about the types of tests. So there's a lot of tests out there for COVID. The ones that you're probably going to hear, there's 3 types that you're probably going to hear the most about. One are antibody tests. Those are tests to see if your immune system has reacted. Perhaps you got COVID and you want to see if you have an immune response to it. You'll get an antibody test. Perhaps you had the vaccine, but your doctor wants to make sure that it worked. You're going to be getting antibody tests. That's very different than tests looking for the virus. And there's 2 types of tests in general that look for the virus. One is called these are essentially kind of viral antigen tests. And viral and antigen tests are looking for the virus itself, pieces of the virus, and those pieces we call antigens. So, and those are, you might hear them called rapid antigen tests, but these are tests that usually are relatively quick, that are specifically looking for whether or not there is virus that, especially in like your nasal or your saliva secretions. There's other types of tests which different people call different things. You might hear them called a PCR test, an RT-PCR test, or an NAAT test, which is, all of these are the same things. These are nucleic acid amplification tests. Nucleic acids are things like RNA and DNA, and that's what the NA in RNA and DNA stands for. It stands for nucleic acid. And nucleic acids, these are the building blocks of our DNA and our RNA. And the nucleic acid sequences of the virus is specifically what these tests are looking for. And these are the tests that kind of definitively say whether or not there are virus particles in your body. And so if you travel, for example, a lot of times if you're traveling, they will ask, like if you're going to arrive in Europe or arrive in Canada, they are asking not for the rapid antigen test, but they are asking for PCR tests or the nucleic acid amplification test. Sometimes you'll even just see that abbreviated NAAT, because these tests are often kind of the most conclusive in terms of saying whether or not you have COVID. These are all very good questions. And please feel free if anyone has any more questions. We still have a few minutes, and I'm happy to answer any questions that are still lingering if anyone has any.
Can I ask a question?
Sure. I hear 2 people want to ask questions. Let's go one at a time, but I'm happy to answer both.
I wanted to know what type of doctor are you? Are you CPA? I mean, are you a general doctor?
Excellent question. So I am an internal medicine physician. My specialty is called hospital medicine. So I take care of people who come into the hospital. I also have a PhD in sociology. So that's my that's my background, and the research that I do is on misinformation. It's on a lot of the confusion surrounding COVID vaccines, which is why this doing talks like this is something I love to do because it's important for us to air our concerns and make sure that we are getting our information from high quality sources. But I'm not a vaccinologist. I'm in touch with a lot of people who specialize in infectious diseases and vaccines. So if I'm not able to answer your questions, those are the people that I turn to.
But do you work in a hospital?
Yes, I work at Weill Cornell.
Oh, Weill Cornell. Okay.
So I hope one day to meet all of you in person, and I hope it's not in the hospital. I hope to be able to come by Stanley Isaacs and give one of these talks in person in the future.
Okay, thank you.
Of course.
I seem to be dying more than other races. People of color, Black.
Please go ahead.
Why Black people seem to be dying more? People of color.
This is an excellent question. So the question, if I heard you correctly, is why are people of color, especially Black people, why are they dying more?
Yes.
This is a complicated question. So I'm going to answer this from a couple of different perspectives. So right now, we do not have a biological explanation for why people of color are dying more. A lot of the explanations that we have seem to be related to what are called social determinants of health. Social determinants of health are kind of all of the social factors that contribute to someone's risk of disease. So you can imagine, just to give an example of some social determinants of health, it's things like literacy. If people are have trouble reading or they don't understand a lot about their health, then their risk of getting various different diseases is higher. And right now, there's been a lot of discussion about racism, about a lot of the different factors that have led to a lot of inequalities between people of color, and that's Black people, that's Latino people, and various different people, new immigrants, and these inequalities leading to increased risk of health problems. And I think we saw this in New York. Now, if you look at the death rates of COVID in New York, the death rates were the highest in the Bronx and in Queens, and in parts of Brooklyn. And they were generally in the places where it was where people of color lived. And that's Latinos primarily in Queens, but in the Bronx and in Brooklyn, it was a lot of Black people. So one of the challenges now is this is changing. People are recognizing that this is an issue, and there's been a lot of effort put into outreach, into trying to make sure that the people that are most vulnerable to COVID, the people that are at highest risk of dying, that is in particular communities of color, that they are there are specific outreach programs to those communities to make sure. If we could mute everyone again, we're getting some feedback.
Issues. I'm sorry. Please call me.
Yeah.
What was they told me is in room 2 about the doctor?
So if you could please mute
there's-
yourselves, we're getting a lot of background noise. All right, thank you. So there's been a lot of outreach efforts to try to build trust in communities of color. And what I would say is that from my perspective as a provider, these efforts are good, and necessary, but not sufficient. Because again, if we're talking about social determinants of health and inequalities, just providing extra access to the vaccine isn't going to solve a lot of those social inequalities that have ultimately led to these health disparities. I think we have a lot of work to do to try to make sure that these health inequalities don't keep replicating themselves with diseases like COVID and other diseases like influenza, because COVID is, I would argue, essentially a symptom of those larger problems. But that's an excellent question. And I think this is something that we should keep the discussion going about, because I think we as a society have a lot of work to do to try to rectify those inequalities.
I have a question regarding COVID testing. Can you hear me?
I can, yes, go ahead.
When you go for a COVID test on the street, and then you go to the senior centers, it said, if you tested for COVID, and that way we're in trouble, because if we go for COVID test, and then when we senior center, if you go for a COVID test, we're not supposed to be able to be allowed in. I don't understand how we're supposed to get a COVID test and then be at risk when we go to a senior center that we took a COVID test.
That's a good question. That sounds to me like it might relate a little bit to senior center policy. So that's definitely a little bit outside my area of expertise. But I'd be happy to kind of let someone from the Stanley Isaac Center answer that question if they'd like to.
In the last so many days, and then we're in trouble, because if we took a test, then we're in trouble. So I'm talking in general, not just the senior center. How do we answer that if we go for a COVID test on the street, and then it says, have you gone for a COVID test? And if you did, then we want you.
So I will admit that I'm making an assumption here, but the thing that I'm assuming is that the senior centers might be concerned that if you went for a COVID test, that it was because you were concerned that you had COVID. And so I think they might be concerned that if you think you might have COVID and you went for a test, that they want to make sure that there's no concerns that you have COVID before you're allowed into the senior center. That's how I would interpret that. And that's because the COVID tests aren't perfect. So even if you've had a COVID test and you're negative, if you think you have COVID, that might be something that they would be very concerned about. So it is a good question, and I think it is a conundrum that we're still kind of muddling through, because a lot of these policies about who's allowed and vaccine passports, I think are still being worked out, and it is frustrating. I know it's noon. I have a little bit more time if people would like to continue asking questions. So I'm happy to stay on and continue this discussion. So please keep the questions coming if anyone has any others that they want to ask.
I had Moderna here twice. Will I come back here for the third one?
If I understood you correctly, the question was, if you've had Moderna twice, should you also get Moderna for the third one? Was that the question?
Yes.
Okay. So the short answer is, right now, that is exactly the public health recommendation. If you have had 2 Moderna vaccines and you're considering a booster shot, that should also be a Moderna booster. Now, you need to tell people that this is a booster shot, because the dose of the booster shot is supposed to be different. It's about half the dose of the initial Moderna dose. Any other questions?
Do I have any effects with the third one?
So good question. So what we're seeing with third doses is that yes, it is possible to have some side effects, but the side effects seem to be somewhat similar compared to the second dose. It doesn't seem to be any more severe. And there's not necessarily, we can't predict who's going to have a bit of a reaction. So for example, some people had a reaction with the first shot, but not the second. Some people had a reaction with the first shot, did not have a reaction with the first shot, had a reaction with the second, and then don't have a reaction with the third. And there's some people who didn't have any reaction with the first two and had a little bit of kind of like, sore arm and feeling like fevers and chills with the third shot. So we can't quite predict, but the thing we do know is that the side effects still appear to be mild with the booster shot. The worst reactions seem to be kind of, at worst, fevers.
I cannot take the first and second one. And since I live alone, I'm just asking just in case somebody to be with me.
Understood, yes. For people who live alone, what I often suggest is just make sure I would aim to get your vaccine early in the week. If you're going to get a booster shot, don't get it on a Friday. So if you do start to feel like you're having symptoms and want to call your doctor, you're not having to call them on Sunday. But if you get the booster shot on like a Monday or a Tuesday, then if any side effects do show up, it's still during the week. And so it'd be a lot easier to kind of call your clinic and someone can check in on you. That's usually what I recommend.
Thank you.
Happy to help. Okay. Thank you all so much for these excellent questions. I just want to see if there's any other questions before we sign off.
No questions, but I appreciate your presentation. I learned a lot. I had a lot of questions in the back of my mind about getting COVID again after I had the shots, because sometimes when I sneeze or cough, I said, is this a cold or what is it? And everything is under suspect, but you were very clear, and I'm very comfortable with the information that you provided us with. And thank you.
Happy to help. Thank you for coming. I'm glad to be able to have these discussions, because I think there are times that we just need information, right? And there's other times that, we've heard certain things and we want to verify that information. And there's other times that we want to talk it through because we've heard of so many different things. Everything's just really confusing. So I hope these types of presentations can serve all three of those purposes.
Thank you very much.
Yeah, great. Well, I look forward to hopefully meeting all of you in person at some later date at the Stanley Essex Center when we're able to continue these discussions in person. All right. Everyone have a good day.
You too. Have a good day.
All right. Bye-bye.
Bye. Bye.